Well, welcome everyone to Kenton County's Facebook and website information. We are trying to connect the leaders in our community who are dealing with the pandemic that our country and our region is dealing with, the COVID-19 infections that are across our community. Today right now we have with us Garren Colvin, who is no stranger to everyone probably who gets on this. And Garren has 37-year history with St. Elizabeth, and now really almost 6+ years as CEO. And we just want to ask some of these very good questions, hopefully to Garren, and get him to update us with what's going on and his impact and his perspective on this epidemic and pandemic in our community. So Garren, I guess I would start off with the question oftentimes everyone's asking is testing. I feel like I want to get a test for this. I want to feel more secure about it. Why can't I just walk up and get a test?
So Kris, I think everyone's well aware that there are some shortages across the country on testing supplies, testing kits, testing swabs. Because of our partnership with Gravity Diagnostics in Northern Kentucky and Covington, we do have availability of tests. So everyone in Northern Kentucky who needs a test has been given a test. I think the concern is the test for COVID-19 is not like a flu test. So anybody who wants a flu test can typically get a flu test. We're just not taking that approach with COVID-19. I think the one issue is if you have a positive test or you have a negative test, the treatment's going to be the same. Therefore, there's really not a reason for doing the test. And really, honestly, the main reason for doing a test is if someone tested positive, then our health department would track down who came in contact with that individual so that we can help stop the spread. Now that the disease is such a community spread disease, you're losing a little bit of that benefit from testing. But the main thing is anyone who needs a test is getting a test. But the main thing to do is call your primary care physician and they will direct you whether or not you need a test, the criterion to get a test, and then we'll go from there. I do know that Northern Kentucky, because of our relationship with Gravity Diagnostic, has one of the best turnaround times now. We did have some issues early on when LabCorp was first starting to do some of the outpatient testing, but I think we've eliminated a lot of that turnaround time. And most importantly, we have put healthcare workers and really most importantly, our first responders at the forefront of that testing now. So our first responders will have a test and the same turnaround time as our inpatients, which is generally 24 hours.
That's fantastic news. And I know your team there at the hospitals are, obviously at the forefront of this thing, along with the police and the EMS staff workers. And so they obviously should get at the front of the line to make sure that they're able to be informed of whether or not they're sick or not. So now
Absolutely.
if I'm as a resident, if I feel sick and I call my primary care physician, what's that going to look like in most cases? If I call, let's say I've got a small fever and I call someone up, what's that physician going to tell me? Are they going to walk us through a couple of steps or take some time to see how it's evolving?
So I think what the physician would do is take some key diagnostics that they can do. Most of this can be done over the phone. And then there's a tiering scale. And then based on that scale, then you'd be referred to a location that would be able to facilitate that test. I think on Monday, we're starting a new centralized testing facility just to make it easier for everyone in the community, and they don't have to come into the hospital to get a test. They can stay and make it a little easier. Not the drive-through that you see with all the horrific experiences, but this is just true. Every person needs a physician order, so it's facilitating getting that physician order and then getting the test done timely.
So Garren, tell me also, just recently, it seems like it's been ramping up some of the points some have been making about this. This has been overblown. We really overreacted in terms of shutting down most of the economy. What's your take on that? Have we overreacted?
I'm a numbers guy, a former CFO. So, I like stats and numbers. The one thing I will tell you is who's leading the country with the least amount of cases and the least spread. And it's going to be two states, Ohio and Kentucky. And if you look at our two governors, Governor Beshear and Governor DeWine, they were the most aggressive in social distancing. They were the ones that wanted to try to bend the curve and spread out the number of positive cases. and I think it's been very successful. It's fair to say lives have been saved by what some would say are draconian measures. Yes, draconian, but safe. And that's where your healthcare professionals are going to kind of land on this issue. And the beauty of it is we don't anticipate that we're going to have nearly the surge that we've had in the past. And I can tell you for St. Elizabeth, our numbers have actually been really flat for the last 7 days, which is supposedly the first or the start of the surge. So I do believe it's a result of the social distancing. I do have a little bit of concern when you open the economy because this is a community spread disease. It hasn't spread in Kentucky because we haven't had a community. There's not been a community events and church. And so I am a little concerned once that economy is opened up, we still have to be even more diligent than we've been in the past with our hand washing, with our coughing, so that we can prevent the second spike. We want that second spike to be way smaller than the first spike, which could be very small, which is nothing but great news.
Well, and the data, it sounds like it's going to continue to increase for a bit, hopefully not have the spike because of the actions you're talking about the state leaders have made. Are there other concerns or things you think that as residents we need to be aware of in terms of if we are engaging with the healthcare community, if we're calling our doctors, if we end up going to have family who are at the hospital, maybe for COVID-19 issues, what should we be aware of presently?
Unfortunately, and I hate this, but one of the measures is the visitation policy at all of our institutions. And so they're very strict, but they're strict for the safety of our patients, the safety of our staff, and the safety of the visitors. We did have a couple instances where we know that we had visitors come in, one from outside the state and a state that's has pretty much of a cluster, a good cluster. So eliminating that contact has been very beneficial. Our staff, 100%, I'm doing this interview not in a mask because I'm the only one in my office, but if I step outside my office, I'm masked up just like a surgeon, just like any clinician. And I can tell you, we're going to have some discussions in our institution about, do we carry that out beyond this initial surge, because it's really helped stop the spread of any disease within our hospital. Our hospital is about the safest place you can be right now. And yes, we have a lot of clinicians who are in quarantine, but all of that is because it's a community spread virus, and they had that exposure outside the walls of our institution. We take the temperature of every person walking through our doors. And if they have a fever, they're not permitted in the house. They have to go home and figure out, next steps based on that. So really trying to protect and keep this place safe. And Kris, before I go any further, anybody in healthcare, not just St. Elizabeth, obviously, I'm passionate about St. Elizabeth and I think the world of our associates. All healthcare workers are heroes today. And what they're doing, it's just amazing. I got a front row seat. It's unbelievable.
Well, and I guess we forget sometimes that those doctors and nurses and other staff, they leave their homes to put themselves in harm's way every day, and they have a choice to not do that. I mean, they could choose. They choose to put the community first and before themselves, which of course is what you're saying there.
Yeah, absolutely. I think everyone with a St. Elizabeth badge has that badge for a reason. They're here for a bigger purpose than just a job and just salary. They want to give back to the community and their service, their servants to others. And this is where they shine.
That's fantastic. Well, I know they appreciate, well, we should be showing even more appreciation. Maybe when all this is said and done, and we should have a big community party just for the first responders and healthcare workers and just celebrate nothing but them.
I'll pay for that party.
Well, let's wrap up on a kind of a note of maybe the happiness of some of this. And that is that there are people who've come into your door who have COVID-19 and they get released and they go back to their families. On one note, the data is kind of presented a little bit about the hundreds of cases that's happened across the state. Locally, that's happening. Maybe you could speak to the fact that there are people getting through this, and then also maybe is the data as you know, as big as we would like it to be? Are we happy with the numbers of people getting through it? What does that look like?
You know, we get every 2 hours, I get a report of how many people are positive, how many people we have under investigation. So we treat all of those individuals as if they're positive until we can rule out that they're negative. And I can tell you our numbers, as I said before, are flat for the last 7 days, which is great. But we have 43 positive patients in our Fort Thomas facility, and it's not the same 43. So we have people coming off vents, which is very hard to do with this disease. We have a lot of people not getting on vents. We're a part of national research. We partner with CTI in Covington to try to bring a drug to Northern Kentucky. And if we're successful, next week, St. Elizabeth Healthcare will be the first hospital in the nation providing this research drug to our residents. And the sole purpose of that drug is to prevent someone from needing a ventilator. So we're excited. And our IDRT, our infectious disease docs, they're unbelievable professionals. They have as much passion as I do for this place, for the safety of their patients. It's amazing to see them work. And I will tell you, some of the drugs that we've been able to receive, it's because Dr. Savani was able to reach out to her counterparts across the world. And we are part of one research that only a handful of hospitals across the country was able to be a part of. So it's amazing to see, and just excited that we're here protecting this community.
Well, and I appreciate it. I know the whole region appreciates that work. People's lives are being saved. Of course, sadly, those have been lost, and we're trying to still acknowledge them and their families' privacy and their losses. And there will be more, of course, but we all know that you're there to try and make sure that number is reduced as much as possible.
Absolutely. And I can tell you, we have worked really closely with the nursing homes in our community. We put a task force together. It's just not St. Elizabeth, it's everybody in this community coming together to do what's right for this community. So shout out to everyone. But we are safer, and these numbers are lower because of this community coming together and for practicing social distancing. So in my yard, I just had to put it back after my grass was cut. It says, stay home, save lives. And we really mean it. That's great. Now, as you jog by, I'm not talking to you. You still need to do exercise, still need to walk. You can still jog, ride your bike. But other than that, you know, please stay home and help save lives, especially the lives of our associates.
Well, it was perfectly stated, and that's a great way to wrap this up. And appreciate the time. I know you're crazy busy. We're thinking of you, praying for your whole team there, and we'll hopefully be back in touch soon with some even better news as this thing wraps up. So thanks, Garren. Appreciate all you're doing.
Kris, thank you for your leadership. It's very much appreciated.
You bet. Just here to help. Thanks, sir. Be safe.
You too.